Rhodiola is one of those supplements where the label does half the persuading before the evidence even enters the room. Adaptogen sounds like your nervous system gets a smarter thermostat. The responsible version is narrower. Some short human studies suggest Rhodiola Rosea may reduce stress-related fatigue or help performance maintenance under demanding tasks. But government reviews still say there is not enough reliable evidence to call it useful for any health purpose.
So when a video says rhodiola destroys stress or gives you energy after a brutal week, what should a normal person hear? Are we talking about feeling less wiped out, actually lowering anxiety, improving workouts, or just buying a more botanical version of caffeine?
First, identity matters. Rhodiola Rosea root contains compounds like rosavins and salidroside, and trials often use standardized extracts rather than random root powder or mystery blends. That does not prove benefit, but it makes the question testable. If a product just says proprietary adaptogen complex, you cannot easily connect it to studies because species, extract ratio, and marker compounds may be completely different.
What is the body story then? If someone swallows a standardized extract in the morning, what is it supposed to be doing between the gut, the brain, the stress response, and that 3 o'clock feeling of being mentally done? And I want to separate plausible from proven. Lab papers can map stress response signaling or neurotransmitter pathways all day, but viewers need to know whether that translates into a reliable morning after morning difference. Is that where the evidence starts to wobble?
Exactly. A systematic review on physical and mental fatigue found 11 controlled studies. Some were positive. 2 of 6 physical fatigue trials and 3 of 5 mental fatigue trials reported benefit. But the same review called the evidence contradictory, with high or unclear risk of bias and reporting flaws. So the honest phrase is not rhodiola works. It is there is a modest, inconsistent fatigue signal worth testing carefully. The best fit person is not someone with unexplained crushing fatigue, untreated depression, or panic symptoms. It is more like a healthy adult in a short, high-demand period, exams, shift pressure, heavy training, or a compressed work sprint, who wants to know if perceived fatigue or task endurance changes. Baseline matters because if sleep, iron status, thyroid disease, medication effects, or burnout are driving fatigue, rhodiola is the wrong first move.
That sounds important. If fatigue is persistent, new, severe, or paired with depression symptoms, chest symptoms, weight change, pregnancy, or medication changes, this is not a supplement shopping problem, right? Where do you draw the line before someone experiments?
Sports data are interesting, but not automatically transferable. Recent small trials in trained athletes reported improvements in repeated performance, perceived exertion, intermittent running, decision-making under fatigue, or resistance test outcomes after short supplementation periods. That supports a performance maintenance hypothesis, especially under repeated demand. But these are specific populations, specific protocols, and often short studies. A desk worker should not assume the soccer player result equals a calmer inbox.
What about the mood lane? People searching rhodiola are often not just tired. They are anxious, low, or burned out. If a review says there are limited but promising trials for depressive symptoms, how careful should we be with that wording?
Very careful. A scoping review found rhodiola among products with limited but promising evidence for depressive symptoms, and a newer adaptogen review included a few rhodiola randomized trials. But limited is the key word. Rhodiola should not be framed as an antidepressant, an anxiety treatment, or a burnout repair tool. If mood symptoms are persistent, impairing, or include suicidal thoughts, supplement experimentation is not the plan.
Because it can feel stimulating, who should be especially cautious? I'm thinking antidepressants, ADHD stimulants, blood pressure drugs, diabetes medicines, bipolar spectrum symptoms, pregnancy, and breastfeeding. Is that the talk to a clinician or pharmacist first group?
If someone is an appropriate candidate, I would treat it like a short, measurable trial rather than a personality upgrade. Choose a clearly labeled Rhodiola Rosea product, ideally standardized and independently tested. Do not start 3 new supplements at once. Track 2 outcomes for 2 to 4 weeks. Morning alertness and late-day fatigue, or training session perceived exertion. If nothing changes, the correct conclusion is not increase forever. It is probably this is not your lever.
What side effects should make someone rethink it quickly? If they get insomnia, headache, dizziness, dry mouth, jitteriness, or feel emotionally revved instead of steady, should they stop rather than trying to push through because it is natural?
My bottom line, rhodiola is not nonsense, but it is also not a stress shield. The most evidence-aligned use is a short experiment for stress-related fatigue or repeated demand performance in otherwise healthy adults, using an identifiable product. Skip the grand claims. No guaranteed energy, no proven anxiety treatment, no burnout cure. If the product is vague, the fatigue is unexplained, or the goal is treating mood, the smarter move is not a bigger bottle, it is better assessment.